If a little green is good, more is even better. Now, back to Green is Good with John Shigarian and Mike Brady.
Welcome back to Green is Good. And Mike, how about Jim Puckett?
Geez, oh man, John, I am just totally amazed. And I want to take a second to salute you because part of what you do as president, CEO, and the guy that created Electronic Recyclers International is you are doing just what Jim Puckett does, and you are really taking a responsible and a very high road when it comes to recycling our electronics. And I know I have taken stuff to you, and it's good to know when Jim was talking about the hard drives. Good to know that when I've taken stuff to you, my hard drives are completely wiped before they get recycled.
Yeah, absolutely. And then they get recycled in the world's largest shredder, and that makes them really go away the right way. And we are proud to be an e-steward. So, hats off to Jim Puckett. He's truly changing the world with the Basel Action Network. And we've got another guy who's also changing the world, David Tusa, the CEO of Sharps Compliance, to talk about how you get rid of unused medications and your medical waste the right way right after this commercial at Green is Good.
If a little green is good, more is even better. Now, back to Green is Good with John Shigarian and Mike Brady.
Welcome back to Green is Good, and we're so excited for a very special guest today, David Tusa, who's the Chief Executive Officer and President of Sharps Compliance Corp., which is a publicly traded company and the leading full-service provider of cost-effective management solutions for medical waste and unused dispensed medications generated outside the hospital and large healthcare facility settings. Welcome to Green is Good, David Tusa.
Well, thank you. Thank you for having me.
Hey, David, this is Mike and I have covered hundreds of subjects since we've had this show now for 2 years. We have never covered these two critical subjects of medical waste and unused medication waste. Why don't you explain a little bit how you started this company and why what your mission and your business is so important?
Well, we started, this company was started by our founder over 15 years ago, and on the idea that you could move medical waste, smaller quantities of medical waste, through the mail versus sending trucks and drivers to pick up small quantities of medical waste. It's a more efficient and more cost-effective model for the proper disposal of medical waste.
Gotcha. And so, why is it so important? Why is medical waste so dangerous?
Well, medical waste is can create quite the hazard. Needle sticks are very common, and you can contract a disease like whether it's HIV or hepatitis C. You see stories in the news almost every day where a child was stuck by a needle in a park, or maybe someone sat on a needle in an airplane. So it's a major issue for the country.
Hey, can you frame the issue for us, though? For those who don't understand what medical waste is, can you define it for us?
If you think of medical waste, think of it primarily syringes, but it could also be things that are used maybe in like a doctor's office, whether it's gauze or anything that's really contaminated with blood.
Gotcha. And how much medical waste is there out there? Is this a growing line of waste? And what could be bad? Does it go in our landfills or clog our sinks or drains? And what happens then if that happens?
Well, let me just to give you an idea of how much medical waste that's generated in this country.
Okay.
Outside. This is outside the hospital and large healthcare setting.
Okay.
But outside of that, the CDC estimates that there's over 3 billion syringes that are generated, with the vast majority of these being improperly disposed of. So it's a huge problem. It's a huge amount of medical waste that's being generated.
That is amazing. And so
the amazing part about it is, remember back in the days when you'd pour your motor oil down the storm sewer, or you would just you would throw the tire in the trash, or the car battery in the trash. We don't do that anymore because there's regulations affecting that.
Right.
But there's actually, outside the hospital and healthcare setting, there's not near as much legislation that's needed to really regulate the proper disposal of medical waste outside the hospital and healthcare setting.
Wow. And are there, I don't know your business model. So do you have 10 competitors, 5 competitors, 2 competitors? How big is your industry in terms of competition?
Well, in the small quantity sector, which is where we're focused, we're really the leader, and we're really the only company that's focused, 100% on both the proper disposal of medical waste and unused medications outside the hospital setting.
Gotcha. And so, can you quantify, how important your work is? I saw on your great website, sharpsinc.com, and for our listeners out there, we're on the phone right now with David Tusa, who's the CEO of Sharps Compliance Corps. It's a publicly traded company, www.sharpsinc, sharpsinc.com. I've been on your website. I love what you're doing. I think this is so important for our society and for the environment around the world. 600 million syringes your company's kept out of the waste stream?
It's an amazing number, isn't it? That's true. Over the last 15 years, we've kept over 600 million syringes out of the solid waste stream. And again, it's just a beginning. We believe that we're less than 5% penetrated in this market, meaning that the vast majority of all the syringes are going in the trash.
Wow. So what could happen? What's the danger? Obviously polluting our landfills and clogging our drains is bad stuff for the environment. No one wants to do that once they learn there's a problem. But to us personally, to our listeners who, they say all politics are local. Well, sometimes all environmental issues have to be made local for people to really take action. How bad could this be for all of us as people? How can we be adversely affected, David, if this stuff gets in the waste stream and then comes back to haunt us personally?
Well, it's the potential to contract a disease that could change your life.
Wow.
And this it happens every day. It's not really talked about a lot, but needle sticks outside the hospital and healthcare setting are a significant issue. As a matter of fact, we launched recently a scholarship program where we ask students going into college to write essays on needle stick incidences and how they could have been prevented. And it's just amazing the stories that we hear.
Wow. So this issue of medical waste and is very, very important, but I also want you to share the other business model that is under your great company, Sharps Compliance Corps. What about unused dispensed medications? I understand that this is a very quiet but growing need for the U.S. citizens and our listeners to find out how to appropriately dispose of unused dispensed medications.
There's over 4 billion prescriptions dispensed outside the hospital and healthcare setting. 4 billion. 4
billion.
And believe it or not, the stats are that up to 40% of all of dispensed medications associated with those 4 billion prescriptions, up to 40% go unused, which generate about 200 to 250 million pounds of unused medications that are either remaining in the medicine cabinet or being improperly disposed.
Huh. So wait a second. You're saying 4 billion prescriptions outside of hospital settings, medical and hospital settings. We're talking on an annual basis.
That's correct.
And 40% go unused. So traditionally, before we're going to discuss the great solution that you have for both medical waste and unused medications, traditionally, what has been the practices of people in America and around the world with regards to unused medications?
What they would do is just traditionally just flush them down the toilet, throw it in the trash. There really hasn't been much guidance, and there hasn't been much education provided to the citizens of the country on how to properly dispose of these.
David, I'm just thinking about we're talking to you. You're in the Houston, Texas area today, but we're here in California, and I know, having lived in Houston, and there are parts of the South as well that are continually in a drought mode. Here in the West, water is so precious to us, and to think of what we're doing with our water when we just add the additional cost of cleaning up our gray water or our wastewater and filtering out the medications, all of the things that could go in there. I mean, I think about medications that go unused. For example, if somebody has a sinus infection and they don't take all of their penicillin, for example, they feel better, and so they just flush it. I mean, this is a real problem.
There's two problems. One, there's the obvious problem of the negative impact to our water system, because the EPA has found there's trace elements of all kind of drugs in most of the water systems in the country. The other one that people don't know as much about is the adverse impact to teenagers. That we're finding out that accidental overdoses of teenagers going into the parents or the grandparents' medicine cabinet is a huge issue in this country. In many states, it's a leading cause of death by teenagers, accidental overdoses of drugs. So that's a situation where your people's lives are in danger, and it's a very, very simple solution with respect to the proper disposal of unused medication.
Wow. So now, the problem is now framed up for our listeners. Yes, we have a medical waste problem in this country. Yes, we have an unused medication problem. Let's talk about the great solutions that you provide with your Sharps Mailback Recovery System program and also with your Sharps Takeaway System. Can you explain to our listeners who are now, you've got their attention, now they realize they should never be improperly disposing of their medical waste, and they should never be improperly disposing of their unused medications. How do they interact with your great company and have your company handle these products not only in a legally right way, but also in a green, environmentally eco-friendly way?
Sure. On the medical waste side, we have a product. The product is called the Sharps Recovery System. It's a product that's used to collect, think of a Sharps container, a red Sharps container. It's used to collect and store the medical waste, and along with it comes a prepaid mailer. And the Sharps container that's full is put into the return mailer, and it's returned via the post office, via the system that's there every day. And when the unit comes back to our treatment facility, unlike medical waste that's typically generated in a hospital, our medical waste does not go into the landfill. We treat it, we actually grind it, we pelletize it, and we convert it into an industrial fuel that's used in high energy-intensive industries. So, again, hospital medical waste for the most part goes to the landfill. Ours does not.
Oh, that's
very, very
awesome.
environmentally sensitive, environmentally driven solution offering.
Right. And then how about the unused medication?
We have two products. We have an envelope product that's available at many of the major retail pharmacies, Walgreens in particular, where you can go in and you can purchase for about $3. You can purchase the envelope.
Okay.
You can take that envelope home.
Okay.
And then you could use it to dispose of your unused medications in the privacy of your own home, and then you just put it in the mail, and then it's returned to us for destruction. Or for the community pharmacies, we actually sell them a box. We call it a takeaway box,
right,
where patients are invited to come back to the pharmacy and bring their unused meds. And the boxes are used to collect and ultimately transport the unused meds back to our treatment facilities.
Well,
very simple solution.
David, this is so exciting. So first of all, how does our listeners out there? I mean, there's tons of listeners that Mike and I have across the country, actually across the world, on the Clear Channel Radio Network, and then it gets uploaded to the iTunes network. How do our listeners avail themselves and find out where they can either buy your envelope product, and can they buy it online on your website? And also, why doesn't and here's just a silly question coming from just a layman like me, why doesn't every great pharmacy across the land have one of your wonderful boxes in it for the unused medication?
Well, a lot of them do.
Okay.
Not all of them yet, but a lot of them do. And yes, you can buy our products on our website, but probably the best way to do it for the unused medication is to go to the pharmacy, go to your pharmacist and ask them for our product. It's called the takeaway envelope, And it's important that you, as the patient or the consumer, talk to the pharmacist about it, how to use it, and become educated on it. There's a hidden benefit which is significant to our takeaway.
Okay.
Because what if you go in, and this is why you should talk to the pharmacist.
Okay.
And you say, look, I've got a half a bottle of this blood pressure medicine, and you know what? It's just I don't feel right when I take it. I just want to get rid of it. Do you have something that can get rid of this? Well, the pharmacist can say, yes, we have it, the takeaway solution, you can use it. But by the way, are you sure we shouldn't change your prescription? Maybe there's an opportunity to change the medication and prevent an illness or a hospital visit by changing his prescription. So it's an opportunity for the pharmacist to improve the interaction between them and the patient. So that's one of the benefits of the takeaway envelope as well, improved communication between the patient and the pharmacist. But that's what we recommend, that you go to your major retail pharmacy or community pharmacy and ask for the takeaway solution. That's the best way to get it.
And for our listeners out there who are wondering, who you cover, as who are your clients? It's self-injectors, doctors, clinics, dentists, veterinarians, tattoo facilities, home health care, assisted living facilities, pharmaceutical manufacturers, government agencies, pharmacies, hospitality markets. You really cover a huge spectrum of people out there that have a need to appropriately get rid of their medical waste and their unused medications.
That's exactly right. It's amazing. By the way, if you get a flu shot in a retail setting, in a retail clinic,
yep,
it's very, very, very likely that the solution they're using to dispose of that syringe used to administer a flu shot is ours. And we, if dairy farms inject cattle with certain drugs, it's very likely that they're using our solution to dispose of the syringes that were used to inject dairy cattle. Our solution's used by doctors, dentists, vets. It just goes on and on and on. There's probably more medical waste that's generated outside the hospital setting than there is in the hospital setting.
That's so fascinating. Can you explain? Obviously the name of our show is Green is Good, and we're so honored to have you today because this is such an important show to get this message out, to protect ourselves, to protect our environment, and to protect one another. What does this, we've read about on your great website, again for our listeners, Sharp, they should go to your website, sharpsinc.com. What is this green waste conversion process? How does that work? The Pelladrix, the PellaDRX system.
Well, we were looking at sustainability issues for us as a company and for our customers, and we just didn't feel right with the medical waste that we were treating. It was going to the landfill just like it does, for all the large hospitals. So we wanted to come up with something innovative. So instead of it going to the landfill, our medical waste is being treated in an autoclave. It's being shredded, and then it's pelletized. And these pellets are used in again, energy-intensive businesses like the cement kiln. But here's a great angle. It has a higher BTU content than coal, which is typically used by the cement kilns, and it's cleaner. So they use it as a fuel. The inorganic portion actually becomes part of the cement itself, hence the repurposing. It works well. It works well for everybody, and our customers are pleased that the medical waste that's being generated is not going in the landfill.
That is such a great story, and that's so important. So not only are you taking care of a problem and keeping it out of the landfills, but actually your process of recycling and disposal is very eco-friendly.
Yes, it is. Very, very, very eco-friendly. We're the only company that does it.
Now, how about, as a proposition for your client base, and as I said earlier, and I named so many, it's almost everyone is a potential client out there for you. What is the time and cost savings to your potential clients, especially medical professionals?
If you think about it, think about when you're in the dentist office. When you're in that dentist office, and by the way, dentist offices generate medical waste. And think about it. They are required by law, healthcare facilities like a dentist office are required to dispose of it properly. And professional offices, doctors, dentists, vets, forever they've been using pickup services, traditional pickup services, where companies come in and literally pick up the medical waste by a driver, and he puts it in the trucks and he drives off. With our solution, it's returned via the mail. So the existing infrastructure, which is the U.S. mail, the U.S. postal system, is already there. The infrastructure is in place. So our cost, the cost of our solution, is typically half, and sometimes even less than half of the cost of the traditional pickup service. So
Wow.
we save money, and the medical waste stays out of the landfill. And why does not everybody do this? It's because just traditionally, doctors, dentists, and vets use pickup services. So we have significant initiatives out there, marketing and PR, to get the word out that we can save you half on your medical waste disposal cost. And by the way, we can actually keep it out of the landfill too.
That is so. Not only is the right thing being done with the unused medications and the medical waste, but you're also, the proposition is save money.
If you look at some of our videos on our website, one of the videos talks about or addresses the doctor, dentist, vet, the professional market, and said, look, hey, in tough, challenging economic times, you know what, doctors, dentists, and vets, they suffer too, because people go to the doctor less. They go to the vet less. And by the way, in tough times, here's a great way to save money on something that you're spending money on every day, which is your medical waste disposal costs, which is quite expensive.
Amazing. This is great. You know, David, unfortunately, we're down to the last 2 minutes or so. What would you like to share? We'll talk about the future of your great company, Sharps Compliance, because it sounds like there's so much blue sky and future ahead if we can just keep getting the word out there. And talk a little bit about being the CEO of a company that really, when you put your head down on the pillow at night, you're doing great stuff for your fellow Americans and for the environment at large. Talk a little bit about that as we move towards a sign-off here.
We really do. We all feel good about our jobs. Our employees, not only do they like what they do, but they're doing good for the country and for fellow citizens. And it's for myself it's a great opportunity. And by the way, I wake up at 3:00 in the morning every morning. And I'll tell you why I wake up at 3:00.
Let me hear it.
Because I'm trying to find out the best way to let everybody in this country know.
Wow.
That there are solutions for these problems that are simple, straightforward, and cost-effective. And that's what we're doing, is working harder to get the word out. We're using social media. We're using traditional media. We're using anything and everything to let people know that there are solutions to these problems, which are very, very dangerous to the citizens of the country, and also where it's required, like a doctor, dentist, or a vet, or an assisted living facility, or a tattoo salon,
Sure.
where it's required that the medical waste be disposed of properly, we can save you half over what you're paying right now. So we're doing good all the way around.
Wow.
Environmentally, we're protecting the patients, we're protecting the community, we're protecting the water system, and we have the opportunity to save dollars for our customers.
Amazing. That is great, David. And Mike and I are just so thrilled that you came on the show today, and we're thankful for your time. Hey, for our listeners out there, to use David's great services at Sharps Compliance, please go to his website, www.sharpsinc.com. You can watch some videos. You can learn some more. You can go use his services or his mailback program at Walgreens or online, buy the stuff. Hey, David Tusa, you are a wonderful ecopreneur and a great leader and truly living proof that green is good.